18% is the availability of patient information. And in the year 2021, coming up, you wonder why that's not available today.
Well, there you see it. It's the first launch of the AUTROS balloon, which is about to be 12 feet higher. Well, here we are. It's day one of the show, and you can see there's thousands and thousands of people who are attending.
And our decremented inventory by that amount just by clicking this once. This is why we say we have things really close to the contract. That's the standards that I get. We got his groceries.
Yeah.
So I want to take mine on yours.
Well, isn't that exciting?
Good.
And how are you doing? There's the CSC team.
Very fabulous. Can't think of a better place to be.
Oh, that's so.
Excited about the system.
That's.
Both presidential candidates talked a great deal about their prescription plans during their campaigns, but a group of pharmacists in town for a convention say Gore and Bush should have also started a dialogue on how to reduce and prevent medical errors. Eyewitness News is live with Tom Jones with some new ideas that could help prevent an old problem. Tom?
Well, John, you're right. Medical errors are indeed an old problem, and they are certainly a deadly one, too. The Institute of Medicine reports that medical mistakes kill about between 48,000 to 98,000 people every year. Drug mistakes kill about 7,000 people. Healthcare professionals here in town hope technology can help greatly reduce those numbers. Medications can get you back on the road to recovery. Or they can set you back or even kill when they're given in error. This father found that out when his daughter was admitted into the hospital with cancer. He says it was a comedy of errors, especially one night when a nurse tried to give his daughter her medications.
Well, it was the right medication and the right dosage. Unfortunately, it was the wrong patient.
Medical and drug errors account for thousands of deaths every year and more than 2 million injuries.
The system is not perfect. It will never be perfect.
Dr. Henry Manesey is an expert in the area of medical mistakes. He says most errors occur when doctors, nurses, and pharmacists don't share the same information. This new mobile computerized system called AUTROS hopes to bridge that gap. With the AUTROS system, once you step inside a hospital, you get a bracelet like this. This bracelet has a barcode on it. What that barcode does is no matter where you go in the hospital, doctors, nurses, and pharmacists even will be able to look up your medical information on a computer like this.
Now the doctor's written the order. That order is transmitted wirelessly to the nurse's station and to pharmacy.
The system checks for drug interactions, correct dosage, possible errors, and a nurse can even scan the patient's bracelet at bedside to make sure it's the right one. Dr. Manesey says hospitals can't ignore safety systems like AUTROS.
We need to think about how we can bring the power of the computer and other automation techniques to bear in assuring the safety.
Now, hospital administrators we talk to love the AUTROS system and others like it, but the problem is those systems cost about $1 million. So what happens is hospital administrators have to decide, do they spend the money or do they go for safety? And a lot of times, safety loses out. Tom Jones, Eyewitness News, live.
Thanks, Tom.